Okay, good afternoon. I'm Jessica Berg. I'm the Dean at the Law School here, and it is my pleasure to welcome you to our Max Mehlman lecture today. Professor Mehlman, as you know, is the director of the Law Medicine Center. This lecture was named for him based in part on some of the extraordinary work that he does, as well as some of the other faculty we have here working in the law medicine field. The donation was made, a very generous donation was made by the family of one of our 1998 alumni, but they have chosen to remain anonymous. So although we have the great pleasure of having the lecture series and of thanking them enormously for allowing us to do this and have such wonderful speakers, I cannot thank them by name. So I will thank them just in general for for being so very generous to us. And I will turn the lectern over to Professor Mehlman, who will introduce our wonderful speaker for today.
So the Mehlman Lecture was inaugurated in 2013, thanks to, as Dean Berg said, a gift from a generous alumni family. And it's in my name, but it actually honors alumni of the law school who've made a significant contribution in the fields of health law, health policy, and bioethics. And it's my pleasure to introduce this year's Mehlman Lecturer, Katherine Hatton. Ms. Hatton graduated from the law school in 1980 with the Order of the Coif, which is awarded to students in the top 10% of their class. She's an Ohio native, graduated from Bowling Green State University with a Bachelor of Arts degree in political science and a Bachelor of Science in journalism. She was a reporter for The Plain Dealer from 1974 to 1978, and during that time she also got a Master of Studies of Law degree from Yale. While at our law school, Ms. Hatton continued to write a column on legal issues for The Plain Dealer, and she was a research assistant for Professor Paul Gianelli, who's sitting back there. And after graduation, she joined the Philadelphia firm of Cohn, Swift, and Graff, where she focused on First Amendment issues and became a shareholder. In 1992, Ms. Hatton joined the Philadelphia Newspapers, Inc., publisher of the Philadelphia Inquirer, where she became vice president and general counsel. After a long and distinguished career in the newspaper industry, Ms. Hatton in 2004 joined the Robert Wood Johnson Foundation, the largest health research foundation in the country with over $10 billion in assets, where she is now vice president, general counsel, and secretary. In addition to her duties at the foundation, Ms. Hatton is a director of the Forum of Executive Women in Philadelphia, a member of the ABA Task Force on Gender Equity, and the recipient in 2010 of the New Jersey Women Lawyers Association Platinum Award. In her online bio sketch, Ms. Hatton states that the staff at the Robert Wood Johnson Foundation, quote, approaches the difficult issues of health and healthcare in America with the focus, courage, compassion, justice, and passion of Atticus Finch, the protagonist of Ms. Hatton's favorite book, To Kill a Mockingbird. Ms. Hatton clearly values her staff, and she also believes in unleashing their creative talents. In training sessions, for example, she has them portray punk rock stars, the housewives of New Jersey, poker players, and crime scene investigators, while she herself often dispenses legal tips and reminders while hula hooping. I'm looking forward to her unleashing our creativity with her talk today entitled The Role of Lawyers in Building a Culture of Health. Please join me in welcoming Katherine Hatton.
This is so different than sitting in the back of the room or drinking coffee on the bridge every morning. It's the first time I've been back in the law school since 1980. And let me be frank, as a law student, I never anticipated speaking here or anywhere about how lawyers could help improve health in America, which just goes to show you, you never know where the long, strange trip of your career might take you. So I thank you, Professor Mehlman, for your kind introduction and the invitation to speak here today. While I may be a better hula hooper than you, I'm guessing I am, your significant contributions as a scholar and your steadfast commitment to your students have left an indelible imprint on our profession. I can promise you I'm not going to talk about biotechnology or genetic engineering. Those are two of Professor Mehlman's areas of expertise, so I know better than to go there. But as a proud alum of this school, I'm happy to be here and to have the opportunity to discuss the role of lawyers in building a culture of health. This law school pioneered the field of health law, starting the Law Medicine Center more than 60 years ago. Still, I'll admit that health law was not my passion when I was a law student. In fact, it never crossed my mind. But a little over a decade ago, I had an aha moment that forever changed my perspective on health and the law. I had been at the Robert Wood Johnson Foundation for just a few months when a colleague came up to me and asked if she could talk to me. She said, "You know, you're new here, and I think you'd have a better feel of what it means to work to improve health and healthcare if you got out of your office to see what's really happening out there." Good advice. The next thing I knew, I was in Boston with her, talking to folks who run a medical legal partnership, a concept completely unfamiliar to me at that time. When I learned that the hospital had voluntarily invited lawyers in to work with doctors, I was surprised. In the city where I had practiced law, the main thing that lawyers and doctors did together was fight over malpractice cases. But as part of this medical legal partnership, lawyers and doctors were collaborating to address a wide range of problems, such as developmental delays in children because they'd been exposed to lead paint, or residents facing utility shutoffs despite laws that were supposed to protect children, the elderly, and the chronically ill. In addition to solving problems for individual patients and clients, that medical legal partnership program worked to change systems and regulations, improving the lives of countless people. It was at that moment that I got it. Health means so much more than simply not being sick. Health is greatly affected by how and where we live, how and where we work. Health requires vigilance, and not just by doctors and other healthcare providers. Health is too all-encompassing to be left just to doctors and their patients during office visits. Everyone, landlords, teachers, employers, parents, even lawyers, have a role to play. Now, I didn't realize that when I was a student here, and the students in this room are no doubt way ahead of me. You might be here because you've already figured out you can play a role in improving health. It's a really incredibly exciting and important time to be a lawyer, especially when it comes to the future of health in this country. Just a few weeks ago, during a talk at Yale, U.S. Surgeon General Vivek Murthy invoked the golden age of public health. He called it a new era within our reach when different sectors unite in common cause of promoting health for all citizens. He called on the faculty and students to step up and be part of this larger transformation in our country and around the world. Dr. Murthy's words should resonate with all of us. So over the next 40 minutes or so, I'm going to highlight some of the ways that lawyers are already building a culture of health in America. I'll start by telling you a little bit about my role as General Counsel at the Robert Wood Johnson Foundation and how I got there. Max has already given you a few hints of that. Then I'll tell you why the Foundation decided it was time to broaden our view of health and healthcare. I'll describe our vision of a culture of health, which has become our new way of looking at the world. I'll give you a sneak peek of the new framework we hope will put the culture of health vision into action. And within that framework, I'm going to share 6 real-world examples of how lawyers already are advancing health. And then I'll open up the floor to questions and I hope some discussion. So before I go any further, let me ask, how many of you, if any of you, know what I mean by a culture of health? Okay. I'm hoping that an hour from now, you'll not only have a clear picture of a culture of health, but you'll be inspired to see yourself and your work as an essential part of making this vision a reality. As I prepared for today's lecture, I did a lot of talking with fellow lawyers. It was great to hear about their diverse paths, and I'll be sharing some of their stories with you. But first, I was asked to share a brief overview of my own somewhat serendipitous journey to becoming a lawyer and eventually to playing a role in building a culture of health. As Professor Mehlman mentioned, I started my career right here in Cleveland as a reporter for the Plain Dealer. That's where I met my husband, Richard Bellotti, who's here today. Rather fatefully, I learned about a fellowship at Yale Law School for journalists who wanted to know more about the law to help them be better reporters. I was accepted as one of 5 journalists the first year that program was offered. And after that one-year fellowship, I was hooked. I returned to the Plain Dealer, but I was convinced I wanted to be a lawyer. Not surprisingly, as a journalist, I was fascinated by First Amendment issues, and I found the whole way of thinking like a lawyer intellectually challenging and energizing. I enrolled in law school here as a second-year transfer student. I found the faculty and students were really bright and engaging. I have vivid memories of great conversation about law, our classes, our professors, and whatever was happening in the news while drinking coffee on the bridge every morning. I'll always remember my class with Professor James McElhenney, the nation's leading expert on trial advocacy and trial tactics. He showed us the power of compelling narratives, which, in retrospect, has been a through line in my career. And Paul Gianelli and Leon Gabinet and many others showed me how important it is to go deep and be passionate about whatever area of law you choose. So the day after I earned my law degree, I got married, moved east, and landed at a Philadelphia law firm where I was able to focus my litigation practice on media issues. After 12 years there, I became vice president and general counsel at the Philadelphia Inquirer and Daily News. I spent 12 years there as well, overseeing legal affairs, including business and First Amendment matters. I was the only lawyer in the building, so I had to learn quickly, look at issues broadly, know when to delegate, and how to triage. One of my outside lawyers, incidentally, was Professor Gabinet's son. So after 24 years representing reporters in newspapers, how did I end up as general counsel of the Robert Wood Johnson Foundation, the nation's largest philanthropy devoted solely to health? Surprisingly, it really feels like a natural progression. The similarities among journalists, lawyers, and foundation program officers are striking. The best are passionate people who want to make the world a better and more just place. Since 1972, the Robert Wood Johnson Foundation has focused on some of the most pressing health issues facing America, from the development of the 911 emergency call system, to reducing tobacco use and exposure, to reversing America's childhood obesity epidemic. At the foundation, we have 8 lawyers, but only 4 of us are in the law department. We're the ones who take care of the traditional legal matters that arise every day, everything from contracts, human resource issues, to questions related to our tax-exempt status. So while we're not health lawyers per se, we play an integral role. By taking care of these day-to-day legal issues, we enable our colleagues to focus on building a culture of health. In a moment, I'll tell you what some of the lawyers at the foundation who work outside the law department are doing. They're developing programs, engaging in health policy, researching how law can be used to advance public health and equity. But back to that question I asked you a few minutes ago. What do we mean when we talk about a culture of health? Last year, the foundation unveiled a vision of America where we all strive together to build a national culture of health, enabling all in our diverse society to lead healthier lives now and for generations to come. When we talk about a culture of health, we mean recognizing that health is central to everything we do. It's the bedrock of personal fulfillment, the backbone of prosperity, and the foundation of a strong competitive nation. And lawyers have a crucial role to play. A culture of health means providing every person with an equal opportunity to live the healthiest, most fulfilling life possible, no matter who they are, where they live, or what their physical challenges happen to be. In a culture of health, business and industry leaders know that well-being boosts the bottom line, and vice versa. And they do their part to keep their employees and their communities vital and productive. It's good for everyone, a win-win. We've chosen to call this a culture of health meaning that everyone has the capacity and the opportunity to live as healthy a life as possible, that support systems and services are in place to help people meet their potential. I know when I paint this rosy picture, some of you are thinking, I'm over-optimistic, I'm naive, I'm really drinking the Kool-Aid. I know that. Because after all, right now, America's health and our healthcare system are not exactly badges of pride. As a nation, we spend nearly $3 trillion a year on healthcare, and yet our businesses continue to lose nearly $226 billion annually because of sick and absent workers. Over 1/3 of our children are overweight or obese, and these kids have a real chance of becoming the first generation to live sicker and die younger than their parents' generation. Recently, a group of retired military leaders told Congress that right now, in 2015, more than 70% of America's young adults are too fat, too poorly educated, or too tangled up in the criminal system to serve in the military. What's more, nearly 1/5 of Americans live in low-income neighborhoods that make it hard to be healthy. Places with inadequate housing and little access to nutritious food, places with pollution and high rates of crime, places with a paucity of job opportunities. These are harsh realities, and we will not achieve a culture of health if we continue down this path. But the good news is that as a nation, we're facing up to the fact that we need to change directions. And we've started to look for new roads, ones that will broaden our concept of health and lead us to better and more integrated ways of improving it. For too long, we as a nation have attempted to improve health by focusing most on the healthcare system. And now we know that's woefully short-sighted. Why? Because health is inextricably linked to social factors like the vitality and safety of our neighborhoods, the strength and resilience of our families, and the cohesiveness of our communities. All these social factors are influenced by our laws, our policies, and our corporate practices. They're all connected, so efforts must be connected as well. So how can we as a nation and we as lawyers start improving health differently? How can we start doing it together? Over the past 18 months, the Robert Wood Johnson Foundation has worked with the RAND Corporation and more than 100 other experts to develop an action framework that we hope will spark more integrated collaborations to improve health. The framework recognizes the connection among the social, economic, physical, and environmental factors of health and well-being. And it invites participation from professionals and people who never thought they had a role to play in helping Americans get and stay healthy as they can be. And that means you. We'll be officially rolling out this action framework next month. But here's a sneak peek. The framework is grounded in 4 interconnected action areas that show health and well-being as the sum of many parts. I know this seems really wonky. Bear with me. I promise it will make sense, especially when you hear about the lawyers already working in these 4 areas. First, making health a shared value. Second, creating healthier, more equitable communities. Third, fostering cross-sector collaboration to improve well-being. And fourth, strengthening integration of health services and systems. Together, these action areas are intended to achieve the outcome of improved health and well-being. And I'd like to point out one other important thing. In this framework, equity is an overarching theme because we need to close the gaps so that everyone has opportunities for health and wellness. I'm not going to dive deeply into the specifics of this framework today. Trust me, we have ideas about key ways to drive change and ways to measure the nation's progress in each of the 4 action areas. I'm just going to share a quick overview, and as I do, I'm going to show you how 6 lawyers at the Foundation and elsewhere already are working in each of these areas to help build a culture of health in America. And 2 of them had never even heard the phrase culture of health until I talked with him. You can see that action area number 1 is about making health a shared value. That means we have to place our goals about better health front and center. Everyone needs to get engaged and have a voice in the process. When that happens, we'll fuel a greater sense of community, an increased demand for healthy places and practices, and a stronger belief that individual actions can make a difference in the well-being of others. So I know you want to know, what does this really look like in the real world? I had the opportunity to speak about Action Area 1 with one of my colleagues. This is John Gouveia. He has a JD from UC Berkeley's Bold Hall and an MPA from the Kennedy School of Government at Harvard. Before joining the foundation, he oversaw AmeriCorps programs in California, and he had a 15-year career as an attorney representing farm workers. John's parents were grassroots community organizers working with the organization that trained Cesar Chavez. So John grew up seeing how community organizing can improve lives and advance equity. At the foundation, John is focusing on an initiative called Communities Creating Healthy Environments. This program works with organizers in communities of color to address the root causes of childhood obesity. The goal is to make healthy weight a shared value in these communities. Change starts by meeting people where they are. So John began his work by asking community members to envision what a healthy community would look like. People had trouble answering the question, he said, because they'd never experienced it. They'd lived in resource-deprived neighborhoods all their lives and hadn't seen anything else. So John drew on his legal skills, analyzing, advocating, persuading through writing and speaking, to build support for the program in collaboration with community leaders and residents. He brings his legal perspective and his background in community organizing to the work of improving access to healthy foods and safe places for children to play. As John explained, organizing for me is all about developing a shared value so that communities demand healthier environments. John sees his whole career in terms of social justice, and he now realizes that all of his efforts, from the time he spent representing farm workers in workers' comp cases, to his community organizing, to working at the foundation, also can be seen as aimed at achieving health equity for all. John's story illustrates the valuable skills you learn as a lawyer can be used in ways other than the direct practice of law. John notes that people respect law degrees. So even if you don't want to be part of a traditional law practice, you can leverage your knowledge and the credibility of a law degree to give voice to those who haven't had a seat at the table. And there are other ways to put your hard-earned legal skills to use. For example, John and I have both made time to serve on a variety of nonprofit boards where our legal training comes in handy. And we've both been active in pro bono work, another way that lawyers can contribute to building a culture of health. You can work for child advocacy groups, or at a clinic that helps folks with Social Security disability benefits claims, or you can help people apply for insurance under the Affordable Care Act. There are plenty of opportunities. So even if you aren't directly engaged in health law in your day job, there are ways you can advance health. Now let's move to Action Area 2, fostering cross-sector collaboration to improve well-being. This means focusing on the importance of collaborations that include sectors typically considered outside the healthcare arena, like education and housing. This is a perfect place for the legal profession, yes, lawyers, to get involved. Remember when I spoke earlier about medical legal partnerships? Well, this cross-sector approach between medical and legal professions is becoming part of the fabric of healthcare delivery nationwide. Last year, nearly 60,000 patients were assisted through medical legal partnerships. Studies show that patients better comply with healthcare treatments after their legal needs have been addressed by such a partnership. I had the opportunity to speak about medical legal partnerships with a 1996 alum of the school, Stephen McGarity. He serves as Associate Director of Community Legal Aid Services in Akron. Steve recently was selected for the Where Health Meets Justice Fellowship by the National Center for Medical Legal Partnership and the National Legal Aid and Defender Association. He told me how the medical legal partnership model is leading him to see each client more holistically. He has a broader perspective on the important role that lawyers can play to advance health. And now, as part of his fellowship, he's working to transform his office's legal aid infrastructure to support health. As part of that effort, he's determined to have his staff experience the same kind of aha moments that he and I have had. He told me that at a recent training for his staff, he asked, "What's the first adjective that people want to use when they're describing a newborn baby?" The answer, healthy. All people want babies to be healthy. Then he said he asked his staff, what things could have happened to the mother that might have negatively impacted that baby's health? Smoking, housing challenges, unemployment, lack of resources or education? And most importantly, what do you think that lawyers can do to improve these circumstances? Steve said his new goal is to address the legal issues that relate to health outcomes. The old Steve said he'd hear about a client whose child has asthma and say, not a legal issue. The new Steve will ask about conditions at the client's apartment, such as mold, to see if there's a way to work with the landlord to address the underlying problem. It's an approach that recognizes that some health conditions can be traced to unmet legal needs or to laws that are unfairly applied or under-enforced. It's an approach that can prevent illness and promote health. Of course, lawyers can't solve every issue, and that's where cross-sector collaboration comes in yet again. As Steve told me, laws can be an instrument of social change, and it's more effective when they cut across other services. For the law students in the room who are interested in medical legal partnerships, he suggested I pass along these ideas. Audit some public health courses. If you're energetic and in the mood for more schooling, consider an MPH. Speak with doctors to learn their language. Steve had a simple example. He said that doctors don't say emergency room, they say emergency department. He said when he started using ED, it changed the way one of the doctors engaged with him. And lastly, volunteer or get an internship with a legal aid society that works with a medical legal partnership. Steve's organization, Community Legal Services in Akron, recruits here for their summer associate program. The Legal Aid Society of Cleveland is another organization to consider. In fact, if you're interested in medical legal partnerships, you're in the right place. Cleveland is a hotbed, this is not a good slide. Cleveland is a hotbed of activity. Not only can you visit the website of the National Center for Medical Legal Partnership, even better, you can talk to Professor McNally Levine about the partnership being developed right now with Rainbow Babies and Children's Hospital. So let's move on to action area 3, creating healthier, more equitable communities. Too often our well-being potential gets determined by our zip code as much as by our genetic code. So we need to improve the environments in which residents live, learn, work, and play. To do that, we need policies that promote and sustain health, and this is where lawyers can play an especially critical role. Here's Michelle Larkin. She's a lawyer who works at the foundation, but she's not in the law department. She and I have similar views. Life is short. You spend most of your waking hours at work. So make sure you're doing something you enjoy. Best case, it's something that improves your life and the lives of others. Michelle's passion is policy. At the foundation, she co-led our tobacco team. In this capacity, she worked to develop and disseminate legal research that was cited when state and local governments adopted smoke-free indoor air laws and higher taxes on tobacco. These laws and taxes have contributed to decreased rates of smoking. I should be clear, there are limits on what we as a private foundation can do. For example, we're not allowed to lobby for legislation. But Michelle and the rest of her team were able to bring advocates together, support policy campaigns, and find other effective ways to use philanthropic dollars to spur policy change. Michelle started her career as an oncology nurse. While she cared deeply about her patients, she made a decision to transition from bedside care to policy work because she wanted to impact not just individual lives, but the health of populations. Eventually, she came to the conclusion she could have an even bigger impact if she had a law degree, so she went back to law school. As she told me, law and policy shape society. They are tools that can be used to create opportunities to make a healthier life accessible to everyone. We need to think about embedding health and equity into all policies and laws to make life better for everyone. And then there's Michael Painter, another colleague who has straddled the worlds of law, health, and health policy. Mike's current passion is figuring out ways to overcome the real and perceived barriers to transforming the healthcare system. Mike is the first to admit that his career has taken some really unexpected turns. He started as a real estate lawyer in California. But after a lot of soul searching, he shifted gears and went to medical school. He eventually became chief of the medical staff at a community health center in Seattle that serves urban American Indians and Alaska Natives. Mike realized he would be a more effective doctor if he saw his patients in a more holistic way, not just as 15-minute appointments, one after the other. And he also began to realize that policy levers could be important to make things better for his patients. Every year, for several years, he saw a brochure for a fellowship program in Washington, D.C. that merges health and policy. Finally, in 2003, Mike took the bait, applied, and was selected as a Robert Wood Johnson Foundation Health Policy Fellow. He went to D.C. and worked for a year in the office of Senator William Frist, M.D., who at the time was Majority Leader of the Senate. For Mike, it was an extraordinary opportunity to use his legal and medical expertise to formulate healthcare policy at the national level. But he didn't lose sight of the importance of our local communities in shaping health. As Mike explained, laws help drive rules, regulations, and policies that promote healthy communities and healthy populations. That's true at the national level, in states, counties, and local communities. We need every level of government and every sector of society to get engaged, and lawyers play a key role. Mike puts it simply, health is a major challenge of our generation, and there are a zillion ways that lawyers can be involved in improving it. To the law students, he sends this message. We as a nation need your training and your skills. And for you mid-career lawyers, health professionals, and social scientists who have an interest in working on health policy, we have this message. The Foundation's Health Policy Fellows Program is accepting applications right now. Our fellows spend a year working in Congress or at a federal agency, combining their real-world knowledge with hands-on political experience to effectively inform health policy. You can go to our website, rwjf.org, and look for information. Lastly, Action Area 4. It focuses on strengthening the integration of health services and systems. This means better balancing medical treatment with public health and social services. Lawyers are essential in forging these connections. This point was reinforced by Jean Hemphill, the practice leader of the healthcare group at Ballard Spahr, a leading Philadelphia firm with more than 500 attorneys. Jean represents a wide range of clients in the healthcare sector, including academic medical centers and medical schools, health systems, physician practice groups, clinical laboratories, and social service agencies. When I spoke with Jean, she emphasized the key role that lawyers play in working with hospitals and health systems, which increasingly are entering into new partnerships with nonprofits and other organizations. And as more businesses and entrepreneurs enter the health arena, they also need lawyers to decipher healthcare rules and regulations. Plus, there are all the legal issues surrounding the sharing of health information and medical records. For all these reasons, Jean has a very sophisticated practice that just keeps on growing. She's not naive. Jean recognizes that clients have their own interests to promote and protect. But while some clients hire lawyers to help preserve the status quo, other clients want to be in the vanguard. For example, Jean is working with a client right now who develops affordable housing. The client is very interested in partnering with organizations that can provide amenities like health clinics and fitness facilities, things that people need to stay healthy. So Jean and her team have been making connections for the client with the hope that this affordable housing development will actually improve residents' lives and be a model for others. Given the transformation of our nation's healthcare system, Jean finds health law to be an exciting and ever-evolving field. For health law students, her advice is to go to a place where you'll learn to be a good lawyer by developing your analytical and transactional skills. That's often a big firm with a diverse practice. After that, you can decide if you want to go to a boutique firm with a health law practice or in-house, to a government agency like HHS or CMS, or to a nonprofit. And as Jean reminded me, there are small but valuable steps you can suggest to improve health wherever you work. For example, at Jean's firm, instead of promoting unhealthy snacks and vending machines, there are big baskets of fruit out to encourage better eating habits. Gym memberships are discounted. A healthier workforce can reduce healthcare costs for employers and employees. Every bit helps. So as we make progress in these 4 integrated action areas, we believe the nation can improve health, well-being, and equity. Why is equity an overarching theme? Well, in order to truly build a culture of health, we can't leave anyone behind. Everyone should have the opportunity to pursue the healthiest life possible. The last conversation I'll tell you about today is one I had with Matt Pierce, who recently joined the foundation as a program officer. He's responsible for programs that deal with the public health law and the legal aspects of tobacco control. Matt's passion is equity. Matt's a young guy, but he's already had some intriguing legal positions. He served as Associate Director of the Health Law and Justice Program at the law school at American University. And as an Assistant Public Defender in Baltimore, he stood at the intersection of law, health, and equity. While working as a public defender, he was part of a team. It included a social worker who linked clients with services such as healthcare and jobs programs, as well as an attorney who focused on his clients' civil legal problems such as immigration and housing. This taught Matt to see the client holistically, not just as someone in trouble with the law. And it helped him to see the many ways that law affects health and well-being. This big picture perspective led Matt to the foundation, where he's working on programs that are aimed at using law and policy to advance health. Frankly, I'm still contemplating some of the questions about equity that came up in our conversation. Questions about how the criminal justice and the prison systems influence the health of individuals and communities. And questions about the unintended consequences of policies and laws we enact. For example, what are the consequences of making prescriptions for opioids more difficult to obtain? And what are the consequences of a criminal record on a person's ability to access public housing, education, employment, and other opportunities? My conversation with Matt illustrates one of the most valuable aspects of this framework. It encourages dialogue as we begin to see the broader picture of health. And it provides entry points for action by lawyers, by educators, by healthcare professionals, by architects, by everyone, as we work together to build a national culture of health. The 4 action areas are connected to and influenced by the others, and they overlap. Progress in one area will advance progress in another, And individuals, communities, and organizations all have roles to play. In just a moment, I'll open up the floor to your questions, and we'll have some dialogue. But to recap, today I've shared a few of the ways that lawyers are building a culture of health, such as John's work cultivating health in communities, Steve's development of a medical legal partnership and a broader view of legal aid, Michelle and Michael's efforts to advance policy change, Jean's work in forging connections between medical and social services, and Matt's focus on finding ways to promote health equity, informed by his experience as a public defender. I had the great pleasure of speaking with these folks and hearing their stories, and I encourage you to do your own research. Take advantage of the outstanding learning opportunities here at the law school, across the university, and in Cleveland. Learn the languages of law and health as best you can. Gain real-world experience through the Health Law Clinic. Get an internship or an externship. Think about working with a public health department. As you probably know, Professor Hoffman is a scholar in residence, providing advice to the Oregon Health Authority about regulating in-home care agencies. I'm happy to say her work is supported by the Robert Wood Johnson Foundation. Consider combining your law degree with one in management, bioethics, or public health. And keep a broad view of what your law career can look like. Spark ideas by looking at health law career guides and by talking to your classmates, colleagues, professors, career development staff. Changing the trajectory of health in America isn't a short-term initiative. It's a cultural shift. It will take time, determination, and above all, the input and innovation of many. It's going to require the kind of collaboration within and across sectors that we haven't really experienced before. And it's going to take the talent, the teamwork, and tenacity of lawyers at each and every step. So we should work together to raise America's health to the level our nation deserves, for ourselves, for our families, and for generations to come. Thank you.
And I believe there are microphones somewhere. Maybe not. Okay. Well, if they come into the room, maybe you have them. If you have microphones, if you don't mind speaking into the microphones, that would be helpful for us to hear questions. Well, waiting. Go ahead.
Yeah.
Go ahead.
Okay.
So thank you so
Right.
much for that excellent talk.
Thanks.
I wanted to ask about something that I read recently. I read an article that said there's so much money being poured into personalized medicine, into finding ways to individualize medicine and find exactly what drug works for what person. And the article claimed that that comes at the cost of money going to public health, to communities, and to really trying to promote public health as a primary initiative. And I'm wondering if you have any thoughts about that.
I suspect there are people in this room who I'm going to want to engage in this dialogue because some of you may know as much and probably a great deal more than I do about this. It seems to me that, budgets are trade-offs, and we have the growth of, personal devices and the growth of personalized medicine. At the same time, we have, all kinds of other conflicting and competing demands for healthcare budgets. I think the biggest impact on public health budgets is probably not personalized medicine, but is actually just budgetary pressures on governmental units in general. I think we need to figure out how all of these pieces are going to fit together. Personalized medicine, if anybody could figure out, for example, some of it, could end up being enormously cost-effective in the long run. In the short run, it's very, very expensive to develop. I don't have an answer for how this country, both the public sector and the private sector, are going to allocate their resources, and I guess I would ask some of you for your thoughts on that issue, because it's going to be a big one facing this country. Anyone have thoughts, Professor?
Thank you for your talk. No, I would like to sort of comment on the nature side of where this is heading. The nurture side, of course, is extremely important, but sort of advances in, especially genomic sequencing, and now with the new wave in CRISPR technology, we're going to see this vast race towards personalized medicine, specifically with regard to the genome. And once it becomes sort of common medical practice, that personalized medicine is going to take a face of, here's your genome, here's all the risk factors you have, how are we going to approach sort of a clinical paradigm for treatment, health, et cetera. So I guess my question is that going to conflict with sort of the nurture side of health, or are the two going to hopefully work in concert to improve that situation as a whole?
What do you think?
I'm worried that nature is going to take off, and it's all going to be sort of the genetic markers. Everyone's going to obsess over that, and I'm sort of worried that nurture is going to suffer at the hands of the quick fix.
I welcome other comments, but I'll say one thing, and that is that I think is perfectly consistent with what I've been talking about this afternoon. Lawyers are going to have a huge role to play as we work through these issues. As you work through the issues of privacy, as you work through the issues of, big brotherism, as you work through all of these issues about all of the matters you've raised, as well as all of the issues I've raised, there's no way that any of these things move forward without the active participation of lawyers. And goodness knows, I mean, you need only look at, cases that go to the Supreme Court, whether it be King versus Burwell or anything else. Lawyers are going to be on every side of the issue. But lawyers have a key role to play as we try to decide as a society what are our values and what's important and how are we going to figure out what takes precedence. And what that's true both in terms of the law, in terms of budgeting, and in terms of every other way you look at these issues.
Hi, it's in the news recently, gun control and gun violence. And I just read the other day that since 1994, a lot of the large public entities like NIH have been prohibited from construing gun violence as a public health issue. And so my question is, what role do the private foundations play relative to analyzing this issue? And you mentioned earlier that you're prohibited from lobbying. Right. I think given the times we live in, gun violence needs to be a public health issue, and I'm just wondering what role you folks play and to what happens with your research and your recommendations. Okay.
We work with a variety of foundations across the country. Some are more or less, some are more active in this area than we are. We have funded programs called Cure Violence that work to interrupt violence in the neighborhoods before gun violence starts. We have been a funder of those programs. There are other foundations. The Bloomberg Philanthropies is one of them that is a big funder of efforts that are looking at how to control gun violence in this country. We work with other folks. We pick and choose among areas in which we work. This is not a huge area of our funding right now. But, one of the values of the action framework, as wonky as it may seem, is that it enables everybody to come in and work on those things that are of interest to them and help sort of coordinate it in a way so that you can look at a variety of measures, which I haven't shown to you today, but to see how the country is progressing on a variety of things, including violence.
Your comments are a good lead into my question. I'm really interested in how foundations such as the Robert Wood Johnson Foundation make health policy, and how they decide what to do, and how that relates to what other foundations are doing. I mean, you're by far the largest, but you're not the only foundation
Correct.
funding research in health and health policy. So do you have like retreats where all of the heads of foundations get together and decide we're going to do this and you can do that? Or is it just that the senior people, the members of your board have those kinds of networking? I'm just curious how, or do you see yourselves as kind of competing against one another?
I think in the past, the phrase used to be, if you've seen one foundation, you've seen one foundation, because every foundation had its own way of doing its own thing, and nobody worried about whether those efforts connected or not. I think we're sort of, everybody believes that we're past that day, that we really do need to work together and collaborate a lot more than we ever had before. That's one of the things actually about this framework. We have talked to foundations across the country. We have talked to think tanks on every side of the political spectrum, because even if some organizations find some of this not in their sweet spot or not at all appealing to them, because some people may want to put more of a premium on personal responsibility, for example, there is still a role for that in a framework like this. So we are very interested in figuring out how to work together with other organizations, how to co-fund some programs, how to find out what other foundations have done that works, that maybe we can take and then help spread, and not think that we have to, we are past the point of thinking we have to invent it ourselves, because we don't think that'll get the job done. We see this as a 20-year commitment, and we're just starting now. And we see that it's going to take a lot of work to get folks to figure out that we can all play together in this.
Hi, my name is Rakaya Yerby. I'm up here in the back. And I'm a law professor here, and I do health equity work, so I really appreciate your talk. I do have a follow-up question that kind of goes on what you just said to Max's question about values and about bringing together people who have a different vision of what health equity is. And so I wanted to ask you just a little bit more, how do you push it further into really talking about values, talking about inequities in society, because that's the underlying issue, right? When we talk about getting people access to education, it's really about making sure everybody has a level of education and the value that we place on that.
Right. I think you're absolutely right, and I look forward to meeting you. The measures that go along with this framework actually try to get to some of that. You can no longer look at health in its own silo, because if folks are in racially segregated neighborhoods where they don't have access to good schools, to healthy food, to safe places to play, we're not going to get to any kind of equity. So that's going to take people who are working in the area of education, people who are working in the area of housing, people from all kinds of spectrums. We can't do this just by looking through a lens of health. So our framework is actually designed so that we can work with folks who are in the housing area, who are in education. We have come to recognize, I mean, again, you can't just look at the healthcare segment of the economy. We're looking at early childhood education and trying to figure out, is there a role for us to play there? Because if we don't change those situations in those neighborhoods, we can't get to equity. So some of our measures will measure things like racial segregation in communities, educational attainment, things that will show whether the nation is moving ahead. Some of the problems that, of course, we face are that sometimes we improve health on some measure. For example, tobacco use may go down, but it may increase the disparity, because the use may go down in higher income, better educated populations, but remain the same or even go up in other strata. So we're really trying to look at that and not just look at the measure of how many fewer people are smoking, but which people are and aren't.
Well, I want to Thank you very much, and please join me in thanking Katherine for
Thank
We have a few gifts for you. Hang on.
Oh, a few. I think he doesn't know it's right here.
Here's one.
Oh, perfect, perfect.
This is an original Whammo
Wow,
hula hoop.
wow. I may demonstrate afterwards. Thank you.
And it does fit in the overhead.
Perfect.
And
This
we
is
also
great.
have this for you,
Oh, thank you
which
so
is
much.
an award for being the Mehlman Lecturer this year. And
Oh, thank you so much. That's
so
great.
it's
It's
just a small
beautiful.
token of our appreciation.
Thank you so much.
We have
I'll
refreshments
demonstrate.
outside, so please join Ms. Hatton and the rest of us.
Thank you.
And thank you again.
Thank you. Thank you.
We can shift these.
No.